During normal functioning or normal chewing, our teeth can generate around 20-30 newtons of force, which is quite normal. During nighttime or nocturnal bruxing or grinding, this can be up to about 800 newtons, which is enough to actually lift an 80 kilo weight off the ground. So you can imagine how much damage can be caused just by doing that all night. Tooth grinding affects about half of us occasionally and about 8% of us regularly. It's basically when the muscles of our jaw, known as the muscles of mastication, they're in a state of hypercontraction, which causes our teeth to come together for prolonged periods of time, and this is usually at night time. And we do it for a lot of reasons, the big one being stress, but then also things like alcohol, drugs, caffeine can also contribute. There's two types of, I guess, the teeth coming together. So the first one is clenching of the teeth. So that's just essentially when the teeth just lock together and the teeth are just in one position. Whereas tooth grinding is actually the active side-to-side gnashing of the teeth. So when the teeth come together, they're actually constantly wearing away against each other. The tooth grinding can cause quite a bit of damage. We can see fracturing, chipping, or wearing down of the teeth. And if it's bad enough, it can actually get into the nerve of the tooth, which can cause pain, and that might need further treatment like root canal or extraction of the tooth. Other things like aches, headaches, jaw aches, toothaches and neck aches are pretty common symptoms of tooth grinding as well. After we've determined the root cause of the grinding, we can then tackle that. So for example, if it is stress related, I would try and get my patient to engage in relaxation methods. That could be hobbies, meditation, possibly seeing a counsellor to sort of figure out why they're stressed. If there is damage caused to the teeth, then we would think about restoring the teeth with fillings or crowns or extractions and implants. But I think the gold standard for tooth grinding at the moment is what we call an occlusal splint. So it's basically like a mouth guard that you wear at night time. I think it's important to note that even though it doesn't actually stop the act of grinding, it prevents any damage from being caused to the teeth. You do get a lot of patients who actually grind through the whole entire splint in a matter of months. So that's how you know that they're pretty severe grinders.